The new government website for up to 10 million key workers and their families to book coronavirus tests online had to close for a while today after it was inundated with requests. Almost 50,000 people in England tried to book a test just hours after the website launched. 16,000 did manage to book a drive-through appointment or get home testing kits. The government says the site for key workers with symptoms will be taking more bookings tomorrow. It comes as the coronavirus death toll climbed again. 768 more people are reported to have died with coronavirus, mostly in hospitals across the UK. The total death toll has risen to 19,506. It doesn't include deaths in the community in England and Northern Ireland. Our health editor Hugh Pym's report contains some flashing images.
Pop-up units run by the Army, part of the new push in England to boost virus testing. The number of drive-through centres is being expanded and more home test kits will be sent out, all to handle possible demand from up to 10 million key workers and their families. But by mid-morning, all slots bookable online for today had been taken by 11,000 people and 5,000 more ordered home test kits. The Department of Health apologised for any inconvenience and said booking would restart tomorrow with capacity expanded. Mike, who's a teacher, had symptoms and wants to know if it's safe to go to work. He managed to get a test slot.
The whole process was very seamless. I was able to register and then I just had to wait for the email to come through. And once I'd got that email, I quickly logged onto the site and selected the testing centre for me, and it has been really easy.
Mike later drove to the testing centre in Peterborough. He showed the email he'd received. It was scanned by a member of staff and the test went ahead. He's hoping for the result by Monday. At another drive-through centre, essential workers who'd had their nasal and throat swabs taken told us about the process.
It was the most painless, easy thing to have been done, and I'm actually amazed that there's not more people here.
I must say that all the stations are empty except mine. There were 2 cars in front of me and there was no one behind me. So they've got the infrastructure in place, they just need the people now.
But some weren't so lucky. One said he'd logged on and been told to expect a text within an hour, but it never came.
You know, I would have appreciated it if after the hour, then I'd got the message to say, well, it's not happening today, can you do it again tomorrow? But waiting the whole day, it's like waiting for a parcel that never turns up.
The Scottish Government said it was ready to go live with a similar system to England, with laboratories like this one in Glasgow analysing the tests. At the Downing Street media briefing, I asked how much more testing capacity would be provided.
Obviously, you don't want people's expectations to be disappointed. Are you pretty confident that you can meet the demand that is out there, certainly in the next week or so?
We'll see how it settles down, but we're encouraged by those 16,000 bookings online. Indeed, 46,000 people went to the portal first thing today. There's some more slots opening up right now as I'm speaking, and there'll be more slots tomorrow and days after.
The NHS has spare critical care beds even with the COVID-19 patient numbers, and the head of NHS England said there might now be scope to restart some more routine work which had been cancelled.
It looks as if we are now coming through the peak of the coronavirus inpatients, and so we've got spare capacity in hospitals across the country, and that means that as well as other critical and urgent services, we will be able to restart some of those more routine services that the NHS is also here to provide.
The Welsh Government is also looking ahead, publishing a strategy for the exit from lockdown, which could involve a traffic light system, moving from red with some restrictions lifted, possibly as soon as next month, to a green phase with very few left in place.
Well, Hugh is with me now. Another very big death toll today, almost 800 more deaths recorded in 24 hours. But there is some good news from the intensive care units in hospitals.
That's right, Sophie. Hospitals around the country have greatly increased their critical care bed capacity. That's intensive care beds with ventilators, converting other wards, bringing them on stream. And of course, we've got these big temporary hospitals which have been created as well for COVID-19 patients. But there was one slide shown today at the Downing Street media briefing that was very interested in showing a fall in the numbers. So if we take a look at that, this is the overall number of critical care beds the percentage occupied by COVID-19 patients. And you can see it's come down in every part of the UK below 50%. And actually there's been a fall of 13% just over the last week in the number of coronavirus patients in intensive care. So certainly heading in the right direction. And we heard earlier from Sir Simon Stevens, head of NHS England, that soon, because of this fall in the number of COVID-19 patients, more routine work could start up again, hip and knee replacements, cataracts, and so on, possibly, I understand, in a matter of weeks. But of course, there's a big backlog to clear from all the cancelled procedures going back over the last couple of months, never mind the existing very large waiting list for routine work. So I think it'll take some considerable time to get to grips with that.
Hugh Pym, thank you. Almost 20,000 people have now died in hospitals in the UK from coronavirus. Among them this week, identical twin sisters. Katy and Emma Davis were 37 years old and died within days of each other. Katy was a children's nurse in Southampton. Her twin, Emma, who had also worked as a nurse, died in the early hours of this morning. Duncan Kennedy reports.
Katy and Emma Davis were twin sisters who dedicated themselves to life, to nursing, and to each other. Emma had helped care for sick adults. Katy had devoted her life to poorly children. Both contracted coronavirus. Katy died on Tuesday. Emma died last night. Their younger sister Zoe asked to speak to us to convey the family's pain.
They were angels on earth and now they're angels in heaven. We're all really close as a family and best friends. And they were my best friends as well. And even though they've left us here, I think they're never really going to leave us.
They had both worked at Southampton's University Hospital. Emma had since left, but last night colleagues clapped for the loss of Katy, not knowing that Emma was to die as well a few hours later.
It doesn't feel that any of this is real, and I'm going to wake up in a minute. But they always said that they came in the world together, so they'll go out together, so that that's what they've done.
Both women shared a home and both had underlying health problems. But the death of twins within 3 days of each other from COVID-19 underscores its merciless, relentless power to shock.
I can't be with my mum and dad, who I love with all my heart. You can't hold anyone because you're so petrified you're going to get it yourself. You can't grieve properly because you can't be with the people that you love.
Katy and Emma Davis. Double the life. A duality of loss.
That was Duncan Kennedy talking to Katy and Emma's sister, Zoe.